Stop eating. These are the top 17 common foods that can cause kidney stones. Welcome to the Quick Health channel. Dear friends, are you experiencing severe pain in the lower back, stomach pain, nausea, vomiting, discolored urine? These might all be symptoms of kidney stones. Kidney stones are very painful. In this video, find out the foods that are known to cause kidney stones. But first, let's get an understanding of what kidney stones are. Kidney stones are deposits of minerals and salts that develop inside the kidneys. They happen for a variety of reasons, from not drinking enough water to eating foods with too much salt, sugar, or high oxalates. The biggest kidney stone on record weighed more than a kilogram and was 17 centimeters in diameter. The patient didn't actually swallow a stone the size of a coconut. Kidney stones form inside the body, but unfortunately, they're extremely painful to get out. A kidney stone is a hard mass of crystals that can form in the kidneys, ureters, bladder, or urethra. Kidney stones form as a result of high levels of calcium, phosphorus, and oxalate in the urine. In many cases, kidney stones can pass on their own, although they are usually very painful and require medical attention. In severe cases, they'll need to be surgically removed. You can prevent kidney stones in the first place by adopting a healthy diet. Avoid salt and foods high in oxalates as much as possible and drink lots of water. Maintain your optimal weight and exercise often. In today's video, we're going to talk about 17 foods that can contribute to kidney stones. They are also healthy foods, so if you have no family history of kidney stones, you should be safe eating these foods. If you do have a history, you should watch your daily intake closely. Before we proceed, please note that everything mentioned in this video is unbiased, fact-checked, and reviewed by qualified health professionals. With that said, let's jump in and talk about 17 foods that can contribute to kidney stones. Number 1. Cocoa powder. Cocoa powder is believed to be an aphrodisiac. In Switzerland, people eat 22 pounds of chocolate per capita. By comparison, Americans only eat 11 pounds. Dark chocolate is an excellent food rich in nutrients, so the Swiss are onto something. However, cocoa powder is rich in oxalates. 100 grams of raw cocoa powder has 624 milligrams of oxalates. That's a lot, so dark chocolate is not such a great idea if you have problems with kidney stones. Number 2. Animal protein. Animal protein is not high in oxalates, but too much of it can contribute to uric acid kidney stones. A small amount of animal protein will not cause kidney stones. However, you should know that large servings could, in time, lead to the accumulation of uric acid. This applies to all types of animal protein like chicken, turkey, eggs, seafood, and red meat. The portion size rule says that the size of your animal protein serving should not be larger than the palm of your hand. That normally amounts to about 4 to 6 ounces, making it a safe size to enjoy your protein without the risk of kidney stones. Number 3. Soy products. Products made from soybeans are excellent sources of protein and other nutrients, especially for people on a plant-based diet. However, they are also high in oxalates. A 3-ounce serving of firm tofu has 235 milligrams, while 1 cup of soy milk or yogurt can have up to 336 milligrams per serving. Number 4. Almonds. Although almonds are a healthy addition to most diets, they are high in oxalates. Skip this nut if you suspect kidney stones. 1 ounce of almonds contains 122 milligrams of oxalates. Pistachios, cashews, peanuts, and walnuts are also high in oxalates. If you already suffer from calcium oxalate kidney stones or uric acid kidney stones, your doctor may tell you to avoid these altogether. Number 5. Rhubarb. Rhubarb is a leafy green vegetable that has a similar texture to celery and a sour taste. When cooked, it is sweet and great for desserts. However, rhubarb is rich in oxalates, so it's best to avoid if you're prone to kidney stones. 1/2 cup has approximately 541 milligrams of oxalates. Number 6. Potatoes with skin. A medium-baked potato has 97 milligrams of oxalates per serving. Much of this content is in the potato skin, which contains high levels of nutrients like fiber, vitamin C, and B vitamins. Number 7. Hot chocolate. Chocolate isn't the best food to eat when it comes to lowering oxalate intake, and hot chocolate is no exception. 1 cup of hot chocolate contains 65 milligrams of oxalates. Instead, swap hot chocolate with chocolate milk, which only has 7 milligrams of oxalates per 1 cup. Plus, 1 cup of chocolate milk provides 21% of the daily value for calcium, which helps prevent kidney stones. Number 8. Beets. Beets are a nutritious root vegetable that are naturally sweet. They are an excellent source of vitamin A, iron, and beta-carotene. Beets also contain fiber, folate, and potassium. However, half a cup of beets has 76 milligrams of oxalates. This high content of oxalates can be a problem for those who struggle with frequent kidney stones. If you limit your intake of beets and you do not have a history of kidney stones, you'll be fine. Number 9. Spinach. Spinach is one of the most problematic when it comes to kidney stones. It is extremely high in oxalates. Just 1 cup of spinach contains 656 milligrams of oxalates. Cooked spinach contains even more, at 755 milligrams. Although spinach is a nutrient-rich food high in vitamin A and vitamin C, it is better to avoid it if you suspect kidney stones. Try replacing spinach with kale, which is low in oxalates. Number 10. Bulgur. Bulgur is made from different wheat species, most often durum wheat. It originates from the Middle Eastern countries, is light, and has a nutty aroma. Bulgur is often added to Mediterranean types of foods like tabbouleh, but it is also added to cereal, veggie burgers, and even squash. Bulgur is high in oxalates. Just 1 cup of cooked bulgur contains 86 milligrams of oxalates. Number 11. Navy beans. Half a cup of navy beans contains approximately 76 milligrams of oxalates. That's a lot, so if you have kidney stone issues, you should consider other types of beans such as lentils, green beans, or peas. Number 12. Raspberries. Many fruits contain some oxalates, like avocados, oranges, and grapefruit. But raspberries are considered a high oxalate food, with 48 milligrams per cup. Raspberries have been found to be capable of expelling stones from the urinary tract, even after acute administration. Number 13. Okra. Okra is a highly nutritious food that contains vitamin K, protein, healthy fats, potassium, and fiber. It can aid digestion and improve skin health if applied directly after boiling and mashing. However, okra is also high in oxalates, so if you suspect any issues with kidney stones, it's a good idea to avoid it. Number 14. Buckwheat. Buckwheat is rich in fiber, minerals, and antioxidants, and has been linked with stable blood sugar and lower cholesterol levels. But if you're concerned about kidney stones, you may want to avoid or limit your intake. A 1-cup serving of cooked buckwheat groats provides 133 milligrams of oxalates. Instead, try white rice, another gluten-free grain, which contains only 4 milligrams of oxalates in 1 cooked cup. Number 15. Dates. Dates are highly nutritious dried fruits, often used as a sweetener in cooking and baking. Date consumption should be moderated, however, as they are high in sugar and concentrated with oxalates, with 1 date containing 24 milligrams. Number 16. Corn grits. Eating grits can put you over your limits of oxalates, as they have about 97 milligrams. If you still want to eat grits, make them with milk to boost the calcium in the dish. Milk and other calcium-rich ingredients make high oxalate foods slightly more favorable when it comes to preventing kidney stones. Otherwise, consider swapping corn grits for cooked oatmeal, which is oxalate-free. Try these overnight oats recipes. Number 17. Miso soup. Miso soup is a staple dish in the Asian culture. It typically contains small pieces of tofu and seaweed. However, miso soup is particularly high in oxalates. Just 1 cup contains 111 milligrams of oxalates. So if you have a problem with kidney stones, it might be a good idea to avoid it. In conclusion, certain foods can cause kidney stones, and you should not take them lightly. Kidney stones are a serious medical condition that require your ultimate attention. The symptoms are usually severe, and you should see a doctor if they appear. Kidney stones can pass on their own, but you've got to make sure you avoid certain foods, drink lots of water, and keep an active lifestyle. Ask your doctor for a diet plan. Diet and lifestyle changes can significantly reduce the risk of developing kidney stones in the first place, especially the most common type, calcium oxalate kidney stones. These types of kidney stones largely arise because of an imbalance in the diet, so keep a close eye on what you eat daily. Enjoyed this video? Hit the like button and subscribe to our channel for more informative videos like this one. Thanks for watching.